Hello guys, this is Dr. Ario here with another session of Health Talk. How have you been keeping? Wow, I hope that you are making healthier choices on a daily basis. So today we are talking about high blood pressure. Yes, I'm sure you've all heard about it before. What is high blood pressure? Or what is blood pressure? Blood pressure is essentially the pressure that your heart uses to pump blood throughout the body. This is a very important function of the heart because we need blood to circulate around the body so that we can get all the vital nutrients that we need or our body needs to be able to function. So when the heart is not able to do this adequately, it is not a good thing. Now, when someone has, over a long period of time, high blood pressure, it puts a strain on the heart. And that means that the heart has to work extra harder to be able to perform its normal function of pumping blood around the heart. Also, over time, when your blood pressure is actually high, what happens is that it slowly damages the blood vessels, okay? And therefore, it is easier for things like clots to form in the blood vessels, and also for things like fat deposits, which normally happens because of our eating habits or our lifestyles, to actually form clots around the blood vessels and cause the blood vessels to become harder and therefore difficult for blood to flow through easily. So the blood vessels then have to use greater pressure to be able to push blood along, which normally it wouldn't have to. Okay, that is why it is important to know about high blood pressure. Now, why should we be worried about high blood pressure? Because like I said, it's actually important for the body to have a level of pressure because the heart needs it to be able to function. But if you have too much of it, it's not good. And actually having a high blood pressure, or what we call hypertension, is the leading cause of heart attacks and stroke. These are very serious conditions that often can lead to death or actually change a person's life quite dramatically. What are the symptoms of high blood pressure? Surprise, surprise, there is none. Yes, high blood pressure rarely causes symptoms, okay? And that is why you need to be aware of it. So millions of people are actually walking around with high blood pressure and not know it. And you could be one of them. Interesting. So who is at risk of high blood pressure? Pretty much everyone, okay? Every one of us are at risk of high blood pressure because by far and large, at least 95% of the population, when you look at the population, there's no obvious cause why we get high blood pressure. So all of us are actually increased risk of it. And it's because over time, because of the position of fat or clots along the blood vessels, increasing resistance in the blood vessels can then raise blood pressure. So any one of us are at risk of that process, okay? It's only a small proportion of people because they have certain other conditions, maybe like diabetes or certain hormonal conditions, or they have other problems that might give a rise, like kidney disease, for example, might give a rise to having high blood pressure. But the majority of us, we don't have to have any specific conditions in order to get high blood pressure. So this is why it is important to always get your blood pressure checked and not base it on your symptoms, okay? So all of us are at risk of it. So what are some of the things that may increase a person's risk of developing high blood pressure? One, through our diet. For example, consuming a high level of salt in our diet, okay? So that's something to pay attention to. Being overweight, okay, can increase your blood pressure because it puts more strain on the heart for one, it puts more strain on other organs, it puts more strain on your blood vessels. Having a family member who has high blood pressure automatically increases your risk, okay? So we're talking about your father, your mother, your brother, your sister, and then you just work it down the family tree, your aunties and the rest of them, okay? The lack of exercise can also increase blood pressure. Remember, exercise is very important. It's important to strengthen the heart. It is important for your organs. It improves your metabolism. improves your chances of losing weight if you are overweight, if you're doing the right amount of exercise. And we did a fabulous video on diet, on exercise, which is on this platform. So please do make time to have a look and have a listen to them so that you can get more details about that. But the lack of exercise can possibly increase your risk of developing high blood pressure. Drinking too much alcohol on a regular basis can also affect your blood pressure. And generally age, yeah? Something that we cannot escape from, all of us, okay, no matter what. So, as we get older, all right, you're more likely to have changes that will cause damage to your blood vessels, that will then increase your risk of getting high blood pressure. Now, you may be wondering, how can I reduce my chances of getting high blood pressure? Or even if I have blood pressure already, or I've been told I have high blood pressure, how can I lower that blood pressure? Well, you can start off by making healthier lifestyle choices, okay? Like you said, high salt intake can be a risk factor. So reduce the quantity of salt you have in your diet. The recommendation is actually, in terms of salt consumption, is that we should aim for a teaspoon, which works out to be 6 grams of salt, okay? And this is just sort of salt going directly onto your food. This has been done taking into consideration other salt contents that might be in the products that you buy. But that is why it is important that when you're buying your food products, actually look on them, because they actually give you all the clues. They tell you about the proportions of things in terms of the nutrients, in terms of your carbohydrate, in terms of your fat, in terms of your sugar, the salt in there. It tells you all those details. So you need to be paying attention when you're buying your products, okay? The other thing is obviously maintain a healthy weight. Like we learned from the previous videos, that being overweight can cause a lot of problems, and blood pressure is one of those problems. Make sure you exercise regularly for all the wonderful benefits that exercise can cause. It would also help to reduce your blood pressure. Take medication, because for some people, actually, when you're diagnosed with having high blood pressure, it might be so high. And obviously, always think of the bigger picture, okay? Having a high blood pressure persistently, continuously, for a long period of time does increase your risk of getting a stroke or a heart attack, okay? And actually, when stroke strikes, when heart attack strikes, it doesn't give you a warning most of the time. It all happens so quickly, okay? So often, some people might need to be started on tablets, medication. And I know some people are anti-tablets and often say, I don't want to take tablets. And that's fine. You have your reasons for that. But also, medications have their place in helping to treat the problem. Now, if you obviously, we say prevention is better than cure. If you can do all the right things, you're more likely to reduce your chances of getting the blood pressure in the first place. But if you find yourself that you have those risks and then you've ended up with a high blood pressure, then I think you'll be doing yourself the right thing by making sure you get treatment if you need it. The wonderful thing is that blood pressure medications in themselves are not addictive medications, so you're not going to be dependent on it. They are tablets that you can actually start and stop, okay? So often when people are on blood pressure tablets, on average, they may be on it for a year or two, depending on their other risk factors, depending on whether they've actually taken charge of their health and doing all the necessary things to reduce their risk further. Most people can safely come off blood pressure tablets. So at the most, if you are told that you need to be on tablets, don't be worried about it. Don't be negative about it. Actually start the treatment. Make sure you see your doctor regularly. Get regular follow-ups to monitor it. And over time, you can have the discussion with your doctor about possibly coming off. And you can easily do that. Okay? Now, how do I know if I have high blood pressure? Well, you wouldn't know unless you get it measured. Like I said, blood pressure does not cause symptoms. High blood pressure does not cause symptoms. That's why we call it the silent killer, okay? Because often, you can be walking around normally and just have a stroke, and because of your high blood pressure. So the only thing and the only way to know you have it is actually get it measured, okay? And you can easily do this by seeing a doctor, by seeing your nurse, by visiting your local chemist or your pharmacist, and you can easily get it checked. Now, you may be asking, should I get a blood pressure monitor? Well, not necessarily, okay? You could always have that discussion with your doctor because, yes, there might be some individuals that have other risk factors they already have a cardiac history, so they have a heart problem, they have diabetes, they have other risk factors that actually monitoring their blood pressure may be important in that case. And therefore, your doctor may advise that get a machine. Now, if you're going to get one, it's always advisable to seek the advice maybe of the pharmacist or your chemist or your doctor, because there's so many varieties of machines around, and some of them can be a bit fiddly, and sometimes you need to get them tested first, calibrated, and all sorts. So it's always good to know which ones to get, and then if anything needs to be done, how often to the machine, because sometimes they can give wrong readings, and then you might end up being very worried. Okay, so it's that simple. So please don't delay. If you've not had your blood pressure checked this year, try and see someone and get it checked. Okay, so that's the end of today. That was very short and simple, but no doubt very valuable information that you needed to know. So remember again, blood pressure, high blood pressure is a silent killer. Its effects are deadly. Often you do not know what hit you when it strikes. Just ask the person who recently suffered a stroke or have had a heart attack, and they will tell you. So please don't ignore it. Please don't wait till you have symptoms, because you will not get any symptoms. Okay, just get it checked. You know what to do. There's so much you can do actually that will benefit you from running the risk of getting high blood pressure through healthier lifestyle choices that I've told you about. We have amazing videos on diet, on exercise, on different conditions that actually can also increase your risk of blood pressure on this platform. So please do make time to have a listen, okay? Knowledge is power, and particularly when it comes to your health, there's no compromise. So thank you for listening to me. I hope you've learned a lot. Please remember to subscribe, because then you will always get notices when new videos come through. All right? And share the video with your friends as well. So you've been listening to Dr. Aria, and from me and the team, goodbye.